Assalamu alaikum viewers, this is Dr. Khawaja Saajid with the program Bone and Health. I'm an orthopedic surgeon. I do hip and knee replacement. I do revision surgeries as well. Today we're talking about total knee replacement. I'm sure many of you guys, especially in Pakistan, over the couple of decades, many people gradually, slowly getting aware of this thing, this kind of operation. If we go back 3-4 decades ago, very few people were aware about this kind of surgery. Traditionally speaking, many people, especially in Asian countries, they were very much scared to go ahead any kind of surgery or surgical intervention of their knee joint. How this has been developed over the years, over the decades, that's a different talk. I would briefly say that because most of the operations related to bones, especially related to joints, they got infected and many people end up with amputation. That over the years and decades developed a big fear among the people that whatever it is, we shall not go ahead for any surgical intervention of bones, especially for the joints. I would say that over the period of time when the science has developed, medicine has developed as well, especially orthopedic. A lot of implants, lot of procedures have been introduced, and many people, many diseases got the cure as far as treatment is concerned. Total knee replacement is one of that procedure that is a cure of arthritis of the knee joint. I'm sure many of you guys must have viewed people complaining painful knee joints, or they cannot pray, or they cannot stand from sitting position, they cannot do stairs. Difficult for them to sit on the toilet seat or go out for shopping. These kind of it's quite common problem. Not only in Asian countries, but all over the world. I would say in Asian countries, but early stage it starts, I would say around 40s, but in Western countries it starts in 60s. That's a lot of different reasons about that. But it's one of those common problems. But it has a cure. Knee replacement is very simple procedure. Very simple than people think of. Briefly, I would say how would I do the knee replacement, because every surgeon has their own protocols as well. But background is same actually. Background knowledge, background procedure is same all over the world. Either you do in Pakistan or any other country. The way I do this procedure, total knee replacement, is briefly I would just explain to you. I do this kind of procedure under spinal anesthesia. We give injection in your back, and from umbilicus downward, you don't feel anything. We don't give general anesthesia. We don't insert any tube in your mouth. You are awake during the procedure. If people don't like about the noise, we just give him some IV injection to let them sleep. It's around 10 to 15 centimeter cut in the midline over your knee joint. We don't take anything from your knee joint out. The bones which are rubbed with each other because of osteoarthritis, because of arthritis of the knee joint, we just freshen those edges, put the implant over there, metal, or the leg bone as well, and in between where the cartilage has been degenerated, has been lost, we insert the plastic over there. It's almost 1 hour procedure. We do this procedure under tourniquet. We apply the tourniquet to minimize the blood loss. Most of my patients, almost I would say even in UK or even Pakistan, I never come across to transfuse any blood after this kind of procedure to any patient, because it's a very minimal blood loss. I apply the sutures which are degradable inside subcutaneously, which we don't need to remove later on. Same day after the operation, 6 hours after the operation, I let my patient to walk, full weight bearing walk with the help of physiotherapist and with the walking frame. And after a couple of days, they can go home. The beauty of this procedure, the single most important benefit of this procedure is the complete loss of pain, day one. The arthritic pain what patient have, that's completely cured, that's completely gone on day one. Patient will have the pain is a surgical pain, just like any other operation, which after a couple of weeks when sutures are removed, they will be okay, they will be fine. That's a single most benefit. Once it's a pain-free joint, then they can walk. They can walk kilometers and kilometers. They can sleep well. They don't need painkillers for that. They don't need injection in their knee joints. They don't need any help. They can walk. They can be independent. That's a single most benefit, and all other benefits are related to that. The problem related to this procedure can be infection of the wound, but that infection can be for any other procedure, any surgical procedure. I would say there's a 1% chance to get infection of the wound. Second problem is a DVT, deep venous thrombosis, is a clot of blood in the leg veins. That could be fatal as well if it could go to the lungs, pulmonary embolism. For that reason, we give the blood thinning medication for 15 days after the total knee replacement to make the blood thin and reduce the chances of this complication. There are no other the problems related to this procedure. No precautions for this procedure. You can walk. There is no precaution that you shall not put weight on this leg, you shall not move it, you shall not walk it. It's nothing like that. It's not like a plating or put a rod in your bone. It's a different kind of procedure. So nothing to worry about. If your doctor, if your orthopedic surgeon suggests you to go ahead for the knee replacement, think about this. You can see a lot of other programs which I have done on YouTube related to hip and knee replacement. You can watch them, maybe multiple answers you can get of your questions, your queries. But this is very simple procedure, believe me, and this is a life-changing thing. Once you get, your life is entirely changed. Your social life is really wonderful. So nothing to worry about. Discuss this procedure with a surgeon who is doing these procedures, not with any orthopedic surgeon or any doctor who is not performing this kind of procedure, who is not trained to do these kind of procedures, but to discuss with the doctor who is performing, who is trained, who is qualified for such kind of procedures. On display is my number, contact number, in case if you want to discuss or you want to get appointment, you are most welcome. Thank you.